Today's talk, we're going to get into Eastern perspectives on the mind, so-called Eastern perspectives, which means ideas from perennial wisdom about the human condition, which was articulated in every culture, particularly in our culture, for thousands and thousands of years ago. There have been such profound insights about the nature of the human condition and therefore what it takes to be happy, what it takes to find meaning and purpose. We're also going to explore insights from science, which comes from a slightly different approach from Eastern ideas. And we're going to see how the integration of these ideas can help us find peace, meaning, and purpose. I chose the title Eye of the Cyclone because, as a metaphor, it represents what perhaps we need to strive for. Because, I've been a psychiatrist now for a fairly long time, for about 25 years, in 3 continents, in Europe and UK, in the US and in India. And what I saw coming to this country about 15 years ago has now taken on an alarming pace and reaching an epidemic proportion. And we are at a juncture where if we don't have the right ideas about the self, then we are all, I think, we are in actually, there is danger. Today, if you look at the statistics, and we're going to start off a little depressing perhaps, but I think, I want to be realistic, and then we'll examine the beauty of life and the beauty of how we can get through this. But the statistics are alarming, aren't they? You know the statistics now about mental health, mental disorders, etc. There was a recent report in the newspaper. People said we are overdiagnosing mental illnesses. And I'll explain why that is both true and false. But the truth is, people are dying by suicide at unprecedented numbers. Death, it cannot be argued about, Death is a very stark statistic. The leading cause of death today amongst young Indians is suicide for people between the ages of 17 to 39, more than accidents and more than any other disease. It's a very strange situation for any species to find itself at a place in its journey where they start to kill themselves, because it goes against everything that we are genetically programmed to do. All of evolution is survival of the fittest, which means survival is at the heart of every living thing. It is therefore unprecedented in life for a living being to take its own life, other than the strange species called the human being. So I always like to begin with the evolutionary backdrop of the predicament of being a human. Because otherwise, people assume, when I'm a psychiatrist, that you must be dealing with people with mental illness. And somehow, people with mental illness must be different from all the rest of us. But honestly, it is only a question of degree and also a question of acknowledgement of the issue that takes someone to a psychiatrist. It is not that people who are suffering from depression, anxiety, common mental disorders that lead to real suffering are in any way different from the sea of humanity. We are all suffering in different ways, and the nature of the suffering is the same. The causation is the same, similar in themes, but it can take on obviously more severe forms in someone who has clinical depression. So we are all suffering as human beings, but it is the nature of our suffering that offers us the hope of transformation. The animal who I always, if you come to my talks, I spend a few minutes reflecting on my envy of happy animals like pets. And I know a lot of clients I've worked with will sometimes tell me that, I wish I could, maybe my next life, I'd want to be born as my pet, or as a pet in a loving house. Because honestly, I think one of the most beautiful lives is if you're a pet in a lovely parent's, human being's house. But really, is that true though? When you examine that, you realize this poor creature that we love so much and that maybe loves us, we're not sure. Some would argue that this has got Stockholm syndrome. You've taken an animal away from its habitat, maybe neutered it, kept it in captivity, developed a strange interspecies bond, and then this poor animal cannot think and it does not have autonomy. So we envy the animal state. We may envy its relaxation. I envy. I have a cat. I envy the fact that every morning when I go to work and I have to deal with all the stress. She's sleeping. When I come back home, she's sleeping, and when she's up, it's only to eat or just to get some attention. It's a beautiful life. But I also know that this cat does not have, obviously, the kind of autonomy, agency, decision making, ability to forecast the future, the ability to change the person who's taking care of her if he is inadequate, which at times perhaps I was, but the cat is hardwired towards acceptance in that. So the point about being a human being is it is, one could argue, a unique privilege in the evolutionary chain, where do have a brain that makes us different from every living being, giving us choice, agency, an ability to think about the past and the future in a way that no other species can. And from there comes our problems, and from there comes our power. You guys agree with? I mean, does that resonate with you so far? That and it's a strange thing to be born with such a brain and then enter into a society that conditions this brain in a particular way for a particular objective that may not have anything to do with your happiness. So I want you to contemplate the question, who am I? Okay, just for a moment, just consider for a moment and take a few moments to consider what comes up immediately when you think about the self. One way of understanding life's problems, and some of the more common problems these days, are what I see as a therapist, what we are seeing in society is what? Stress and anxiety, lack a reduced tolerance and patience interpersonally, a sense of numbness, meaninglessness, purposelessness, emptiness, identity crisis. These are the common downsides. On the positive side, we have entered an era where, obviously, and this comes, as I said, this is the good side, which also has the shadow, that we have entered an era in our country where people have the more ability than ever before to determine their sense of self, to determine how they're going to live their life, to determine the values that guide them. It is new. Now, here's the problem, the way I see it, that when you have such widespread mental health problems, there must be something in culture, in the way of thinking, that is affecting many people, causing problems. Obviously, the genes have not changed. Something has changed environmentally and culturally. And what has changed is, in India, it's very much more stark. The change is the sense of self having become more and more hyper individualized. There's been increasing focus on the self. That is the way of modern life. We focus a lot on our identity, on ourself, on who we are, on what we want, what we need, on how we can have our best possible life, and therefore, and how can we become our highest self. Would you agree with me that this is a prevailing cultural norm of our times? One that seems normal now, but if you go back 20, 30 years ago, this was not the narrative. People were not talking about how to become my best, highest self. Would you agree? What do you think that has done to us? Firstly, the reason, the first point to appreciate is this: all of these ideas of hyper individualism are extremely, intoxicatingly compelling and feel very powerful for a society like ours, that for many, many people, they experience repression. You had societies like ours where the individual had to subsume their identity to the larger collective. Now, if we didn't care about the individual and you looked statistically at that society, people were happier statistically. Statistically meaning there were less suicide, there was less clinical depression, less clinical anxiety, more interpersonal harmony, more social harmony. Would you agree? Yes, coming to that. Less innovation, less individualism, less creativity, and if it so happened that the system was not kind to you, less agency to change it. You had therefore I think our entire country was waiting in a sense for liberation. And then came post liberalization, changes in our economy, in our culture, globalization and technology, and mobility and opportunity. And so we moved from being a collectivist culture to being just like any other globalized culture, which is now the focus on the individual. Now it has shifted. You see, now the burden of your happiness or the problems that you face are entirely in this new construct, your creation. The American myth, which I, as a psychiatrist, I saw them, I think, brainwash people, was this: that you are the master of your destiny. You have the power to create unbelievable success for yourself, happiness, love, wealth. And if you aren't successful, it is only a reflection of your inability to do hard work or your inability to be smart, etc., etc. It sounds like a very empowering idea, but when I saw a country where they don't take care of people who are suffering for no fault of their own, then you can see that it's an argument you're making so that you can surrender that responsibility. It, in my view, is a mythology, and it is incorrect to say that we are the masters, entire masters of our own destiny. I've been humbled by the work I do by listening to, thousands of hours. I've had the privilege of being part of people's lives, and I know that bad things happen to good people and good things happen to bad people. We don't like that, and somewhere we assume that that's not going to happen, but this does happen. And so, this illusion that America created, in my view, it helps people be better consumers. It helps the society be more fragmented in a way, because when everyone's focused on themselves, they buy more, they are better consumers. And one doesn't know whether it is an accident or it is a purposeful attempt to do that. But there is no doubt that the mythology of hyper individualism, the mythology that you're the full master of your destiny, changes your relationship with the universe in a way that ultimately will cause entitlement, increased boundary setting, and therefore isolation and loneliness, decreased interpersonal tolerance, and fragility. And this idea, right, is being perpetuated through every medium, including through therapy and through spirituality. See, the funny thing about spiritual ideas, and by spiritual ideas we mean ideas that are beyond yourself, is transcending the self, right? What is spirituality? Spirituality means the exploration of that which is beyond your individual self. This could be through religion, God, spiritual ideas and connection with the universe, a higher purpose, serving something or somebody, connections, love, relationships, a larger meaning that you are connected with. So anything that takes you out of yourself is, in that sense, spiritual. The research is very clear and overwhelming that if you connect with something beyond yourself, it is very powerful, very healing for mind and body, and very good for mental health. The American idea changes that and changes the relationship of the individual with everything else. The sense of connection, the sense of humility, the sense of connectedness is actually reduced by this idea of hyper individual. Now, in spirituality, the very interesting thing to me is how they manage to seed these toxic ideas even within spirituality. And one of the, I think, good representations of that, of Western spirituality that carries with it, rather than transcendence, further focus on the self, is this idea of the law of manifestation and the law of attraction. Those of you who like it, just hang on. I'm not going to take that away, but I just want to explore it just a little bit. It's all about the nuance, you know. By the way, 2006, there was a famous book called The Secret that came out. I was in the US at that time, and I saw how people really loved it. It was a huge hit in the huge hit. This was not a people who had ever from gotten into transcendence from a spiritual perspective. For us, it's not new in it. Right from the Gita, Mahabharata. I mean, all our texts are really about transcendence, and our culture is about transcendence in that way. But for the American, this it was very interesting. Yo, the universe got your back, is what basically they translated it to. Basically, the universe is my, you know, my boy who will go and do all that I want if I think hard enough and I desire something hard enough. They corrupted the idea of transcendence and made it something so hyper individualistic and narcissistic. Can you imagine the belief that my own little self, if I crave something badly enough and I desire it badly enough, the universe will give it to me? And if I don't get it, it's because I didn't desire it enough. And therefore, it's somehow my fault for not manifesting it in my life. Now, I'm not saying good things can't happen from that construct, and we'll talk about why it can lead to some good things. But you can see the toxicity of the idea when you walk into a pediatric ward of children who have cancer. Can anyone say they manifested the cancer, or anyone who loves them manifested cancer? Any loving God would not manifest that cancer. We have to figure out a way to deal with the existential problem that we don't always get what we desire. And to me, the strangest thing about this spiritual idea was that it goes against the grain of thousands of years of observation that desire is at the root of suffering. That was Buddha's great insight, one that has stood the test of time. And I often reflect that the reason Buddha is so popular is he was ahead of his time. I'm talking about the Gautama Buddha, who, as you know, famously, the legend and the truth is that he was a noble guy from a rich family who had everything that money could buy, who realized very early on that this is impermanent. And he said, if this is impermanent and this is transient, and my mind craves stability and permanence, and all of us do, where is happiness to be found? This was a burning question leading him to great insights about the nature of human suffering. And it's a travesty that current therapists are not taught about what Buddha said, because he was one of the finest psychotherapists to come out of the world, and he came from India thousands of years ago. And in the books, they teach us starting a history started with Freud, who came up with some bizarre ideas, which only to me betrays his own issues, right? He had the most bizarre ideas because of Victorian repression. That is the background it came from. And they taught everybody all over the world that psychiatry started with the West. And go back a little, they say Western philosophers. But thousands of years before that, there was such deep perennial insights. And when he talked about impermanence and transience, I can't help thinking that isn't the world even more so? I saw someone recently, and by the way, if I share any details, they are what we call composites. In other words, I don't share details for confidentiality reasons, of course. But when I share a case, these are what we call composites, which are a collection of facts that combine to give you an idea of the situation. So consider a person who said, I was maybe in her 30s, early 30s, working hard, trying to live a life. She connects with someone. There's maybe they exchange some messages, they go out on a date, and next thing you know, she says the person ghosted me, right? The person just stopped replying, transient, completely. Come back, come back home, you take your fast fashion clothes, put it in the wash, it shrinks a little more and doesn't last. And everything in this world actually lasts less. And I can't help thinking the Buddha was talking about transience at a time when probably they made much more robust things. Relationships were much more robust. People stayed together for a much longer time. And yet he said, this is transient. We can't attach to it. And here we are, fast forward to a world where things are even more transient. And the only thing that she turns to that will unfailingly not cause dissatisfaction or disappointment is you pick up the phone and you press a button, and sure enough, there is some stimulation predictably, and it doesn't disappoint. Or it disappoints just enough to create an itch where you keep looking for that. Okay? So, we are at a situation in our culture where we have left behind the repression of the past and we don't want to go back. And we are being presented with an ideal of how we should be, which I think is the hyper individualistic idea from the West, that happiness will be found when you get your highest self, when you get everything that you desire and you work very hard towards it. and you keep doing more and more and more. The problem, as you know, is it may lead to success, good. It may lead to some other good outcomes, but will it lead to happiness, relaxation, peace of mind? Or will it create a constant life of stress, striving, strife, dissatisfaction? As we believe, then the answer to that dissatisfaction is to get even more stronger and even more of a stronger person. Because the West has tried all the therapy that we can try. They've spent hundreds of billions of dollars on therapy, and they are telling us this is the approach. And my point is, it is we can understand some ideas, and we'll talk about what, but certainly the key idea that we need to figure out is how can I connect with a sense of self that is beyond my own individual self? Point one. Point two is how can I connect with a state of relaxation even as I pursue my goals? Because the answer is not in complete renunciation, obviously. The answer is not in renouncing the world that we're engaged in. The answer is engaging with this world in a way where we stay centered around relaxation. And in order to do that, then the way we act, the way we connect with what we do has to change from the way that the West and therefore current globalized culture tells us how to be and how to. I'm going to just pause here though and take some questions and then continue the discussion. And we're going to do a couple of practices that help us connect with the center of ourself, the eye of the cyclone, the idea that no matter how much turmoil there is externally in the world or how much turmoil there is in the mind, there is always a center of stillness and relaxation in every human being. This is the most, I think, most beautiful um, thing I know about people and about all of us, that even as we hurt and we suffer, there is the core of us that is still and at peace, but that stillness is not the same stillness as being frozen. The stillness of peace and relaxation is not the same stillness as of being frozen. It is a different kind of stillness, but one that you already have and that you already are. We cannot get in touch with it because the entire world pulls us out of that. And because now we have the technology to pull us out of that, we rarely have space and time even to just introspect and do nothing, let alone go deeper and connect with that stillness. So, in order to get there within, we have to go through the boredom and the difficulty of sitting with ourselves before we can really find and connect with the inner stillness that we all have. And that's a beautiful idea, but I've seen it time and again in our work where if we connect, people connect with it, and suddenly things are transformed, even though the situation has not changed, and even though some of those thoughts and worries might continue. I'm going to pause and take questions, and then we will. Yes, sure. Yes.
My question was the fight or flee response, right? That's hardwired into the proto humans also, because it's a survival mechanism. Wouldn't that override your your conscious effort, at striving to stay centered,
Correct.
and around relaxation and, like you said, the inner stillness. You understand my question? That's the
That's a
Because
great
here
question.
you have
Yeah,
a hardwired response which is
correct.
millions of years old.
Exactly. So, survival, as you said, is a primal response. As you said, it's part of every living being. And the uniqueness which I was referring to about the human being is a very strange way the strange way in which our sense of self was shaped, and therefore the ways in which the brain attempts to protect that sense of self. The difference between other non human animals and the human being is the existence of narrative. The narrative self is the self that you inhabit, meaning, in this very moment, in this precise moment, without past, without future, without any memory of the past, without any knowledge of the future, your sense of self is what? Nothing and everything. It is something. It is something, but it is, as you said, what is it? It doesn't need analysis. There you got a taste of what animals are feeling. Will the animal run away when you attack it? Of course, it survives. But will its neural systems hold on to the sense of threat after the attack has passed or long before the attack could be foreseen? No, it doesn't have the capacity to do that. Its sense of self doesn't extend into past and future. That's why I said it's a bizarre joke on us that you give us this brain. To me, that's why I keep saying when people ask me, and people just don't, I think this, I want to make this very clear that, people, again, I said this before, but again, the point being, I'm surprised how one would not have a level of anxiety in this. I would be surprised if any smart human being, as they're going through adolescence and young adulthood, does not have a sense of anxiety about this world. It would be very strange, would it not, for us to come into this complex, crazy world and say, yeah, I get it. I have no anxiety. It's all good. This guy's got a problem, clearly. Bro, you got to be more anxious. You know what I mean? There is so much going on, the complexity. And this is why when I see society is becoming more hyper individualized, what happens then is that complexity in relationships, there is no external framework to hold you now. In the past, what people didn't like about past relationships, and I'm talking about perhaps more about romantic relationships or marital relationships, was that there were certain functional roles that people had to abide by, like it or not. Not much freedom in that sense. But the idea that when you emancipate, you suddenly magically become yourself and find kinship and it's easy to get along, no, it's going to get harder because I'm a person, you're a person, and we are trying to get along, and it's really, really hard. And that is why we develop such a big brain. The size of our brain is to do with the complexities of our social relationships, of trying to figure people out. And I find, like I was saying, as we become more hyper individualistic, you'll see human beings turning to relationships with, when having more pets. The common thing. Study the pet ownership rates and loneliness rates, they correlate, and individualism rate. America is number one. Is getting there because people are finding that it's very difficult to get along with another human being. It's difficult because of the complexities of our narratives. And we love the simplicity, the vulnerability, the ease of the non-human man. So coming back to your question, what has happened to us along evolution was we first got neural systems for survival that were very similar for all mammals. And even within our mother's womb, it's interesting how the brain develops because the brain actually develops within your mother's womb. By the second trimester, your brain has already got parts that are to do with respiration, blood pressure, what we call the autonomic nervous system. And then a little later, shortly by the end of the second trimester, you're starting to develop what we call the limbic system, which is the hypothalamus, hippocampus, amygdala. These are structures of the brain to do with threat, fear, emotions, primal feelings, which connect to the autonomic nervous system. Then you're born with some amount of the prefrontal cortex, which continues to both grow and get pruned, meaning there are a lot of synaptic connections, meaning a lot of connections between nerves in the baby's brain when they're born. Then, depending on the environment, certain nerves are preserved, certain nerves get atrophied by a process called pruning. So you can imagine now, in all our journeys, we think our life, when do you think your life started? I mean, you'll say, yeah, I consciously remember maybe from age 5, 6, 3, 4, right? What's your earliest memory? Maybe 3, right? Usually that's the age the hippocampus develops. So we have no conscious memory of below that age where the hippocampus gets a narrative. We get a narrative memory. But even then, by the way, if you recollect, it wasn't a clear, I am so and so person and I am in grade 1 and I'm going to wear this shirt. And it wasn't that. It was unself conscious as children, correct? Early childhood. You recall that time? Anybody? Hopefully, we all do. You recall a time of unself consciousness where you kind of didn't care much about what people were thinking of you and you were just running around and people said, nahi beta, put your clothes on. You know, we were taught, and that's my point, that there's this, again, a strange thing about human rearing and human parenting and human beings is that shame actually is a part of our upbringing. It's not there in other animals, obviously. Yeah. Guilt is slightly different from shame. When I talk about shame, I mean that my own state, the way I am, there's something wrong. We are all afflicted. At the end of the day, we are all looking for a sense of okayness. I am okay the way I am. If I'm not, I have to get somewhere, then I will be okay. Because we started life from a sense of okayness, which was completely and had to be quickly reduced by the world. It's a very strange thing. The socialization of the human being is a very strange thing. The disconnect between our private and our public, and all of this, a very strange thing. So, what happened then? This narrative self got hinged onto survival mechanisms. Now the problem is the sense of self. It's not just the body, it's everything I'm attached to. And that is what the primal systems are now fighting to preserve. But it's more ambiguous, this threat. It's not a clear threat. It's far easier to run away from the, well, easier, I don't know, but at least you know what you got to do when a tiger is attacking. It's like this. For example, I think that tomorrow I need to get good promotion, because then it will improve my salary, which will then afford a better wedding for my daughter, which will allow me to maybe feel better about myself as both as a father or whatever. Another person may be attached to certain people in their lives, not just attached to the people, but to also how they should be with them. That my sense of self depends on how this person is with me. And there's so many things, subtle things like this, obvious things and subtle things, that our mind now says this has to happen in order for myself to be complete or safe. The issue is our self does not feel complete, and when it doesn't feel complete, it's not safe. So then these neural systems are not so subtle. They can't differentiate between, oh, this is just a need or a want, is this existential, or it starts triggering. And that creates a chronic fight, flight, freeze response, which creates elevated cortisol levels. And that's the amazing thing, isn't it? It's a belief system, it's a thought, it's a feeling, and that feeling affects real neuronal systems. And through what we call the hypothalamic pituitary adrenal axis, goes from the brain down to the adrenal glands, where if it's chronic stress, it elevates stress hormones like cortisol. So when people say it's just in the mind, it's not just in the mind. It's in the brain, it's in the body, it's in every cell of our being. It's not imaginary, it's real. And what happens then, in my view, is when you have a society where everybody is in this state, the problem is when we are in fight or flight, it reduces the ability to love. It reduces our ability to be patient, kind, compassionate, empathetic. And as a society, we're losing that energy because everybody is feeling this sense of, many people are feeling the sense of depletion, sense of stress. And therefore, family systems, organizations, entire society is devoid of enough love, empathy, softness. And I think we need a certain number of people to start bringing that energy more and more before the world can change, perhaps. But to continue down this path means that as people get more individualistic, more focused on their own needs, there will be increasing isolation, increasing stress, anxiety, threat, and that's the problem. Yes.
Yeah, I wanted to ask you, you said that earlier than age 3, we don't have any really conscious
Usually.
memory. But from what I understand about attachment theory, your sense of whether you're securely attached or
Correct.
insecurely attached gets formed before 2,
Yeah.
if I'm not mistaken.
Correct.
So would it not be that whether you are securely attached could and this is known, would definitely affect your how stressed you would get
Yeah.
by things.
Yeah.
And so it all begins right with parenting, right in the beginning,
It
as a
begins.
base foundation.
No, it begins even before. So my point was, yes, even though you don't have conscious memories, that is why it's more powerful. Those early memories, they're not memories; they're implicit experiences. When I started off in psychiatry, back then it was fashionable for people to do CBT, or cognitive behavioral therapy, which I really didn't find very useful as a therapist. And I remember very clearly early on a person telling me in therapy that, I was a trainee psychiatrist resident first year doing CBT, and I didn't really like the approach, but it was something, when you're training, you try different therapies. And she said something that I've heard, of course, many clients, people tell me in therapy, which is, okay, I get it. I understand that I have to think this way, and I understand that my thoughts are negative. I understand how to make my thoughts positive. I understand I'm lovable. I understand I'm good, but I can't shake that feeling inside. Inside me, I had that feeling that I'm not worthy, I'm not lovable, I can't be accepted, I feel insecure. And that is exactly why I trained in internal medicine and psychiatry, because it's very clear to me, now, luckily, the world has, I think, accepted that the body is is an intrinsic, perhaps a fundamental part of emotional experience, which, by the way, was the strangest thing to me, that we took so long to get it, because everybody, every layperson gets it, that your body is where you feel. I mean, our metaphors are laden with body, you're carrying a weight on your shoulders, your throat choked up with emotion, you have butterflies in your stomach, your knees tremble. I mean, everybody knows our language is embedded with it, and yet it took psychiatry a long time to act. Western psychiatry. In the East, we had yoga, etc., a long time ago. So it starts fundamentally when the limbic system is formed, which is intrauterine. So it starts early because the baby is being prepared for whatever environment might be outside. And if the mother is stressed, then the baby has to have defense mechanisms and may be born in a threatening world. The die is loaded a little bit, no doubt about it. And so it occurs, and that is the intrinsic feeling that is not changed top down. What we call top down means when we're trying to change our feelings using thought. And that has been the approach of a lot of psychotherapeutic methods. And it is useful to some extent, but you also need to work bottom up, which means the essential feelings have to be attended to where they are in the body, in the breath. And again, by the way, this is why East-West integration, right? That what was the whole point of yoga was this. It was a unbelievable system to normalize the autonomic nervous system. So, to answer your question, we all have something called the autonomic nervous system, which, as the name implies, is autonomic. And the autonomic nervous system has, you can think of an accelerator, the sympathetic nervous system, which drives the fight, flight, but not just that, all the adrenaline, etc. Then there's the brake, the rest and digest part, the parasympathetic part, innervated primarily by the vagus nerve, which slows the system. This is part of your autonomic nervous system embedded in deep structures of the brain, which send fibers upwards and downwards, meaning it's connected everywhere. So it's connected intrinsically to your heart rate, blood pressure, breathing, what we call autonomic tone, even the how much your vessels are constricting, how much blood sugar is being released because of how much insulin is being released. All of this is being regulated by the autonomic nervous system. And the setting point, the set point of the autonomic nervous system will vary depending on our temperament and very early childhood environment, etc. And that then is the first template that sets the foundation for the evolution of who we became. You see, how did we become how we became? Firstly, it's just a very strange and bizarre thing, no? That you're born, and by the time we are born, we have a certain temperament. Okay, I think, by the way, a lot of times in contemporary therapy, I think people overemphasize the role of parents and underemphasize how important things even parents can't control are. For example, grandparents, genes, intrauterine environment. All of this is affecting the person's brain and genetics and epigenetics. So by the time we are born, we have a certain temperament. In the same household, you will have maybe 2, 3 kids with different temperament. How is it that in the same house, with the same parents, people grow up so differently and have different memories, different ideas, different perceptions? Well, because they were born slightly differently, firstly. Two is the way they shaped their parents was different. Parents are not a blank slate who are going to be the same with every individual. There's what we call goodness of fit. How do you fit in with your child's temperament? What do they evoke in you? Let's say a parent is anxious and they have a child who is born with a little more risk-taking gene. Suddenly the child is going all over the place. The mother or the father is getting a little anxious. They're going to interact differently with that child than the child who is not doing that. Or another parent who has not got that risk aversion will treat very differently. So you see, we have different micro environments. a child who is maybe falling more because they're doing something more, they get into trouble more, they have. So, in other words, our temperament starts shaping the way others are with us. The way they are with us, then we shape. And this whole game is what's it about? It's about the child wanting to feel safe and secure. To your point about survival, that's what we are fighting for initially. We are fighting for survival. We want to survive, and we want to survive because we don't know what that environment is like. The baby, because it has no memory, if the mother goes for 6 minutes versus 6 months, they don't really know the difference. There's no time. They may start crying, and then how are they comforted? How does their nervous system respond? So much happening. So it's oversimplistic, I think, to say, okay, the parent did this, this is what happened, this is why you did that, and so on and so forth. And I'm telling you that, that's why I have an issue with, for example, people will do podcasts with successful people, and they'll ask that person, hey, what's the reason for your success? Tell me. And they will only say what is culturally, a commonplace in that time. 5 years ago, it was passion. Follow your passion. Today, I don't know what is it. Cold showers, I think. Whatever. It's get your cold showers. Do your one meal a day or whatever. So it's like they're just saying. But when I talk to people and I say, "Why did you do that?" They'll say, "Well, I did that because," say, a person might say to me, "I failed in an exam, and because I failed in that exam, I said never again will I do badly in studies, and I became the greatest student." Really, is that why you did that? Why did person B do the exact opposite in the same situation? You don't know why you did what you did. Ask yourselves, why did you do that? You don't know why you did that. Why did you do? And that's why the worst thing to say to someone is, if I were you, I would have done X, Y, Z. Well, if you were me, you would have done exactly what I did. That's what it means to be me, right? If I were you, just saying, you are you, and you're trying to tell me what it's like. That's the worst advice. So, why did you do something? It's mysterious, it's miraculous, and it's in that interaction. Anyway, so bottom line is, you start, if this is without awareness, this is happening, you're trying to survive. You may believe you have to be strong. You may believe you can't show weakness. You may believe that you have to make a lot of money. You may believe that to be loved, you have to sacrifice things. There are countless beliefs that you've been trained to believe, because those were the belief systems that were formed out of this early, very primitive brain, because it can't think clearly, but it can feel with all its heart. The child feels so much with so little awareness, that, again, another strange feature of the human condition, by the way. Very strange feature. We are born premature. I don't know if you know that. You know that, right? We are born premature because the brain evolved to be too big to come out of the mother's womb fully developed. It's a strange thing. Very strange. And so what happens then is extended, what we call neoteny, this extended period of dependence of the human child on the parent, right up to age 35. It's a long time that the child is still your child, and you're still, concerned, and so on and so forth. No other animal. Spider eats its young day one if you're not doing something. So we are very interesting, right? And so, sense of self, no agency. We're just responding. We're trying to find safety. We're reacting. We're developing a worldview, and then we step out into the larger world, and then the world tests our worldview. And that's where anxiety can develop, depression can develop, because our worldview was not consistent with navigating reality. It was okay for the home. It was okay for the school, maybe, but it wasn't okay for the world, for the largeness of what's happening. And that is why I say, when people go through anything like depression, anxiety, and then they come to therapy, they go through, it's not about, in my view, one aspect could be thought of as treatment, but it's more importantly, it's about transformation. When a person goes through a difficult time like that, it means that a certain belief system has been challenged so much by life that they're being asked to think about life and themselves differently. And therefore, it's liberation from that which was never healthy to begin with. And that's why when people break down, they actually have got an opportunity to clear the past and to be reborn with the right set of ideas about themselves. One that they think through very clearly with their clarity, rather than being told who you are, what you should do, etc. And so this whole journey from feeling defeated by life is really a defeat of our constructs in our head. And then we say, what can we learn about reality and about ourselves that allows me to navigate life. And that's the process, by the way, of if anyone's going through difficulties, actually, in a way, calling us to transform and to revisit certain fundamental ideas about safety. And we have to come back. At the end, we come to this idea, this awareness that my happiness and my safety ultimately lies in making sure that it does not depend on anything that is outside my control. If my sense of safety, well being, or happiness is determined by anyone else's behavior, the more it is, the more problematic it is for me and the other person. A lot of our relationships in the world are trying to control each other in order to make us feel safe and complete. And we can spend lifetimes doing that, but it's also very liberating to pause and claim this freedom that we were denied, or we were not told that we have, or we didn't experience it as when we were younger. And so we just went from saying we want our parents to take care of us to we want to get good marks to we want to get a good job to maybe multiple other things. It really didn't change a whole lot. We're still asking for something or thinking something will get us that. And I can't tell you how many times I revisit this idea with different people with different problems that they are facing, that that difficulties make us confront that, claim our freedom, but it's not isolating. It should not be. It doesn't mean I detach from everyone, I disconnect from everyone. It does not mean I detach from what I want to do. It means that I unhinge my sense of completeness and my sense of happiness from everything and anything else. What if this were enough? We are afraid sometimes to accept that. What if you were okay just the way you are? What if you've always been okay just the way you were? What if it's okay to pursue and get better at things, at skills, at career, but retain the sense of okayness throughout our life? Because I think that is so fundamentally important. And that is what the center of the cyclone is. That is what the eye of the storm is. It is coming back and saying, I give myself permission to disconnect and detach my sense of happiness and well being from all that I cannot control. How do we do that? Well, our traditions taught us different ways. Western science corroborated a lot of these ways. We do that depending on your personality, your temperament, your way of life. They offered us different solutions, which I think have stood the test of time largely. Number one, immerse yourself in your deepest driving desire, your purpose, that which you're born to do. If you know that, if you've elucidated that, if you've figured that out, but life is sometimes a journey to figuring that out. The second part, and these are not by any means mutually exclusive, often I think a combination of this helps. The second is one of absolute surrender, absolute faith, absolute trust, what is called bhakti. The idea that which I cannot control, I surrender. And going back to this, what we talked about the different brain structures, this idea of surrender has, if and letting go and relaxation is no use if it's just here. It results in a letting go of mind and body and breath. Like when you exhale and you sigh out. And I invite you to do that now. Take a deep breath in through your nose and breathe out. It was a beautiful book which I never read, but I love the title, called Waiting to Exhale. You read that? I think it was about women who couldn't find the right guy in their life, but it was a dating book, but the metaphor was beautiful. I thought, waiting to exhale. We are waiting to exhale. Can you sense that? What is that? You're releasing something. You're letting go. So the idea of letting go is no use unless there's a feeling that my body, my breath has let go. So the question is, what are we holding on to? Sometimes, and as because we are intelligent beings, we want to figure out what, and that's a lot of talk therapy. But we can also let go without figuring out what we are holding. Do we have to know what we are holding on to, or do we have to know that I just don't have to hold on to anything? The reason we are holding on is because the survival systems think it's unsafe to exhale. It says it's unsafe to relax. See the irony and the paradox. It says, be tense. Why? Because it's scary to relax. Because if I'm relaxed, I'm scared that I'm not tense. Something bad will happen. I want you to notice this as well. Take a breath in through your nose and out through the mouth. Do it one more time. And as the breath leaves you, at the very end of the out breath, try to think something. Try to think when all the air has left you in that pause. Tell me how easy or hard it was to think. You do it at the right time. You notice when all the air has left, there's just that blankness, pause before the in breath. Your mind is still. It's almost impossible to think. Try to do 2 into 2 or 2 into 3. That's almost impossible. You notice that. It's just a moment. It's a beautiful thing. Every moment our autonomic nervous system is changing, by the way, to sympathetic, parasympathetic. I talked about the brake and accelerator. Well, every time we exhale, it's the brake being pressed. The blood pressure is going down with each out breath, by the way. Your heart rate goes down with each out breath. It's called sinus arrhythmia because there are connections from the breath to autonomic nervous system. And it's a bilateral loop. So when you're stressed, you're going to inhale more, exhale less. Most people today in the world have moved from a normal human healthy breath rate, which is how many times per minute? What do you think normal healthy rate is? Who said 20, sir? Do I have a 20? Anything else? 35 while running away. No. So normally, by normally I mean you go take a drive from here, go 200 miles into some rural area. I'm romanticizing it, but bear with me. You go there and you have a bunch of people living by the farm. They're sitting, they're just chilling, looking at the cows. It's idyllic thing. What their breath rate will be at 6 to 8 a minute. Yeah, 8 a minute. Yeah, the body at relaxed state is not 8 a minute is about 11. I mean, do the match. How many seconds per breath? Yeah, 8, 7.5 seconds, right? That's a lot. That's not a long time when you think about it. Most people today are breathing 16 to 18, 14 to 18. Normal, even doctors will say, yeah, that's normal. We are all, and how did we increase the rate? What did we stop doing much of? Exhaling. So we replace the exhalation, more inhalation. We change the ratio. Ideally, when we are in real rest, your exhalation is almost double the length of inhalation. Now it's almost 1:1. Sometimes even exhalation is shorter. We also change the way we are breathing. Instead of using the diaphragm, I mean, diaphragm is always being used, but there's a lot more restriction, tightening, and use of the what we call accessory muscles of respiration, which is your chest, your strap muscles here, lifting the chest like that. Now you do that only like if you saw Durandhar, they're doing that a lot. You're, you're fighting, or if you're macho, or you're trying to hold, like it's not a relaxed, peaceful thing. When it's not peaceful, it's not chill, and that's really because that's fight and flight, giving you extra vital capacity. It's also changing the blood pressure. Remember, it's going now elevated. Heart rate also has changed. Heart rate variability, something called heart rate variability, which is beat to beat variation, that decreases when this happens and increases the risk, by the way, for cardiac problems. So what do we have to do? The one step we can take is use this window into the autonomic nervous system, which is our breath. And a simple thing to do, and one of the simplest thing to do, is to reset your breathing so that you're breathing normally, where your exhalation is nice and easy. Letting go. If you're not letting go psychologically, you're not letting go of your breath. I have seen, as many therapists have, that in session, if someone is storing a lot of feeling and we invite them to breathe, on the exhalation, some people cannot do it. There is so much, maybe perhaps trauma, pain, sorrow, that when they exhale, they're in touch with that and it can get very painful. It's remarkable. So your body wants to exhale. Your mind is preventing the body from exhaling. How should you do this breath? I'm not asking you to do pranayama or the forceful, any force. The key here is to get out of the way of your body, to allow the body to let go of the stored breath. In India, we'd call it block prana. Energy is not flowing. And by the way, I know that sounds unscientific, but as a person who's interested and who's specialized in mind and body, I can tell you it's quite interesting, these early observations about chakras and meridians. Because what happens when we hold the breath and we're anxious, our body now stores emotional energy in the form of tissue being held. So we have what we call the myofascial system, which is basically connective tissue in your body. And this connective tissue runs all over your body, under your skin. You know, it's that white tissue. And by the way, doctors traditionally were not taught to appreciate the significance of the fascia. When I was learning, and it's still the same apparently, when I was doing dissections and we cut bodies, etc., the anatomy manual tells us cut through the skin, and then it says cut through the superficial fascia, and then just look at the nerves and the blood vessels, as if the fascia is an irritant that we must get out of the way to see the real stuff, which is the nerves, the veins, etc. And so many doctors think it's just whatever, it's just some tissue there. It's a very interesting tissue because it runs from head to toe. There's superficial and deep fascia which are connected, and therefore every organ of your body is basically covered, rather lined with this fascia. Now, this fascia carries within its layers nerves, blood vessels, lymphatic systems, everything. To me, the Indian idea of energy was something that flowed behind this, if you like, and therefore, if there are blocks in that system, for us in Western medicine, we see changes in the tissue. It is not something that, in my opinion, conventional doctors, those who are only doing physical medicine, are very interested. My specialty, because I did physical medicine and psychiatric medicine, I became very interested in issues like migraines, back pains, digestive issues, where I knew that modern medicine has not solved the problem. If you go with a back pain to an orthopedician, and I have orthopedician friends, no disrespect, but the bottom line is they are trained to think of it mechanically and surgically. So back pain is a classic example of something that affects people because of mind-body issues more than body issues. But you go to the doctor with back pain, and the doctor says, let's do an MRI scan, and he says, you got a slip disc, the slip disc. And they show you a little bulging, and they say, and you say, yeah, it makes sense because I have sciatic pain. Now, I'm not denying any of that. But if you look at the data, 35% of random people who got MRIs done had a slip disc with no symptoms. The correlation between what you see on the MRI and symptomatology is not very clear, is not direct. We also know that while there is bulging, here's what I think is going on. And there are many people, famously, Dr. John Sarno has written a great book. But in my own work, it became very clear to me early on that when I was seeing patients with back pain, it was often preceded by some event in their life which ordinarily would have made them very sad, fearful, or angry. And then they didn't express it, they didn't feel it, and then a week later, 2 weeks later, they would develop slip disc. And it was so clear what the etiology is, that when you're stressed and when you're anxious and when you're angry and when you have all these feelings, our body is obviously angry and sad and fearful. And when it does that, what happens? Your belly gets tight, right? You'll agree, you know. And I want you to, by the way, it's important for all of us to know our bodies well, to know how our body is speaking to us. Our belly gets tight. What happens when our belly gets tight? Our intra-abdominal pressure increases. What happens then is, because the way we breathe, our intravertebral pressure increases. And also their postural changes, and that can actually increase the bulging of the nucleus pulposus in the disc, causing pain and pressure symptoms. So yes, the mechanical problem was there, but we are a dynamic system. It was because we had feelings that were not being expressed by this person and that were being. In this way, you know, a lot of chronic pain, neck pain, back pain, headaches, migraines, and then other things that you may not think are psychosomatic, like eczema, asthma, they all have potent, the reasons often are mind-body problems, emotions that have not been resolved, and they're coming across as physical symptoms. It's extremely common in our country, and one of the failures, in my view, of the psychiatric system is that our diagnostic systems don't capture all of it. Many people don't even feel sad, don't even feel depressed or anxious. Their body is not feeling inflammation is running short of time. Inflammation is very interesting because inflammation is probably at the heart of many conditions, including depression, heart disease, etc. So, inflammation can occur because of stress, and inflammation can cause anxiety and depression as well. It's a bilateral relation. But essentially, when there is stress and anxiety, the body is in an inflammatory state because of stress hormones being released and because the body is now adapting for survival rather than for thriving. So, in our country, by the way, I want everyone to be aware that if you or a family member has unexplained physical symptoms of any kind, and, and you've had reasonable medical workup done, then you must really explore what is happening at an emotional mental health level. So, I want us to understand that it's an interplay. Okay, when you look at cause and effect. So, someone, for example, has a tendency for asthma means they have a tendency for what we call bronchospasm, which means that the airways get constricted. Now, the airways get constricted partly because genetically they have a loading for, say, something called mast cell that releases histamine, etc. But stress modulates immune system powerfully. There have been a lot of studies looking at exam students, even transient stress. You take exams, take a blood test of people who are going to take a stressful exam, and we see that something called natural killer cells, which are immune system cells, are weak because of stress. So, it's called psychoneuroimmunology. There's a whole field that looks at the connection between emotions, brain, and immune system. And we are appreciating what exactly the East was. That's why the East didn't get into body parts. In Eastern medicine, whether it's Chinese or Indian medicine, there's no concept of organs as such. Because for them, it is this that what we are discovering in Western science. Are they separate really? Or are they all one unit talking to each other? It is a conceptual, to some extent, an arbitrary conceptual uh, differentiation. We are the ones who are calling this the hand and saying it stops here. Who says it stops here? It doesn't. And by the way, in this body work, those of you who have done body work of any kind, you will notice the connection in the fascia. Someone's doing an acupressure on your foot and the head release because it's one unified system. It's like a balloon, by the way. And this balloon metaphor I also use for mind and body. Meaning, if something is pushed out of the mind, the body will bulge. If something is pushed out of the body, not taken, the mind will, unless the whole system releases and lets go. Letting go means resetting that autonomic nervous system. Atopic dermatitis is really about, it's like eczema, atopic dermatitis, all of them. Yes, it means the person may have a genetic tendency. It is probably more to do with physical. So, but you, so it's not, as I said, it's all multifactorial. But generally, if there's any stress, easing that, doing some breathing work, some relaxation, if the child is old enough, would also help. I think it's also important to know that for most things, it's not one thing. Conditions are created by when there's a perfect storm of multiple things. And so many times we want simple linear narratives, but they're often multiple causes. I want to do a meditation before we end so that we can experience some of this. I think I'll take one more question and then we're going to end with some breathing and meditation. Maybe quick questions, and I'll respond really quickly. How do you overcome conditioning? We will talk about it in meditation in just a moment. Right. How can we do something? I like the question. I think it's really important that all of us do something. This is my point in today. One of the big things why I want to do these talks is I know that therapists and psychiatrists are not going to solve the problem. We don't have enough psychiatrists. We don't have enough therapists. And there's something happening in all areas of society. That means, in my view, every family needs at least one person who is perhaps more interested in this and learns and is more aware about mental health and some of the ways in which to maintain it, and then becomes that source for their family. The prevalence of just anxiety disorders alone is 15%. If you add anxiety, depression, etc., etc., it's at least one in every family will suffer something fairly significant. But this is preventable with the right approaches, the right perspectives, and I think it's really is going to absolutely need a community, 100%. Sure. Yeah. Thank you. Yeah. I do actually. Sorry. Oh, the question is, have I developed any tools, or do we have any tools that can help? Thanks for asking that, because it has been my life's work to create a therapy that ensures that we are not following therapeutic ideas just imported from America, from the West. In my view, those ideas, while some of those ideas and some aspects are helpful, it ultimately will be detrimental to our society, because the way it's being practiced can increase the sense of self-absorption and fragility. What I have developed is a psychotherapy that integrates ideas, perennial ideas from Eastern wisdom, meditation, and Eastern spirituality, particularly about the nature of the self. Because to me, all the problems are determined by how we think of who we are, and from that follows what is human happiness, etc. And because the implicit ideas in West is this hyper individualized idea, this therapy balances that. And the idea of this therapy is that each one of us, in a way, has to experience two aspects of the self. One aspect of the self is what we ordinarily experience, which is the construct of the roles we play, the ideas, the narratives, the real world, in other words. We have been conditioned, and your question was, how can we solve the conditioning? The question is, what have we been conditioned into? And one of the most important, significant things we were conditioned into is the nature of the self being this individual, and this individual has to get XYZ in order to be happy. The aspect of the self that we should connect with and, in fact, know that this is who we are is what I call the universal self, also called the unconditional self, also called the non dual self, which is the self that is, without narrative, without judgment, without labels, but undeniably is. Because culture, society, and the workplace does not even talk about this, it seems strange. What does that mean? Well, what it means is, firstly, can you sit with yourself without stimulation, without the phone, and develop the capacity to sit with this? Having done that, you develop the ability to meditate, which is to connect with awareness without judgment. When we do that, we feel, nobody has to say anything, we feel peaceful, we feel relaxed. And if we do that often enough, then we realize that that is who we are, because we see that all these constructs are keep changing, these selves. How can I mean, I am that, but I know that's not permanent. But this centered feeling, this indescribable feeling, this feeling that has no labels, is who I am. And if I know I am this and that, by connecting with this unconditional sense of safety and self, it liberates me from being attached to those concepts in order to find happiness. But I don't detach, because in fact I can play with life. If I took life so seriously, then I cannot play with life. I'm not having fun in life. But if I play a game, even though I lose, I'm having fun. How can I experience life as a game if I understand how to attach in the right way? Because in the game, I'm not detached. I want to win. I really want to win, but I'm not a professional. So I'm not paid for it, so I can enjoy it. In fact, the word amateur comes from amore, which means to love. And amateurs are those who do it from the heart. Professionals are those who are paid for it. And as you know, the quickest way to ruin something you love is to be paid for it, as they say in some research, by the way. So to approach life as an amateur sportsman, not a professional sportsman, but an amateur sportsman, as a game, which I think also includes, not I think, in my work also includes a spiritual perspective, that there is a transcendent consciousness. And in that sense, I am visiting this for a period of time that I do not know. in us, the first time that my consciousness in this form, and for all of us, the first time your consciousness in this form has visited in this way, that itself is a beautiful mystery. So if I change my framework that I must get certain things in this life in order for it to be a life well lived, which is the current narrative of our times, to it is a life well lived if I engage with it with curiosity and mystery and wonder and still pursue everything. That would shift things because it changes the way I exist as a person. So, in integral self therapy, which is what I call it, the integral self is two things. It is my experience of the transcendent as well as my experience of the mortal. And I think we need both of those. And the experience of both of those is called the integral self. And I think that offers a new way of dealing with both the material world that we have to and want to, and by all means should succeed in. Because that was the problem with our ancient philosophies. If they argued that it's about vairagya, it's about renunciation. Sure, it can be at some point in time, and it can be for some of us. But today's world, spiritual ideas cannot be wait for renunciation. It can really inject that liberation right here, right now, and be completely compatible with the material world of success. So this is a course that I'm actually currently training therapists in, because I'd like therapists to practice an integrated form of therapy, which integrates this, also integration of mind and body, which is very important. It also examines sort of the roles you play and so on using hypnotherapy. So we're currently training a bunch of therapists, and I started the foundation, Nirvikalpa Foundation, which is a foundation in the Nirvikalpa Integrated Therapy Foundation. The purpose of this foundation is to do research, training, and awareness in creation of integrated therapies for India, by India, and then for the world. The world did not solve mental health problems. They have clearly not solved mental health problems, so we don't want to learn from them. We solved mental health problems during a time of great success in our historical past. It's there in our learnings and our literature. It can be integrated very seamlessly with the West. And I think that is the right way to approach mental health, where it does not become a mental illness, treatment heavy kind of situation. Rather, it becomes a social thing where everybody is living the right way, thinking the right way, creating the right connections and relationships, so that we are a nation that doesn't need as much treatment. We use therapy for growth, which is what I think it is also about it as well. Nothing wrong with treatment at all, obviously. My point, though, is that we need to prevent, because a lot of this is preventable. And the reason we need to prevent is because we just don't have enough professionals, and obviously we want to avert a lot of stuff. And we also know in our work, by the way, what's most gratifying in this work is that, whenever one person transforms, they transform a lot of people around. A lot of people, generations transform with one person's transformation. Each one of you is so powerful when you think about how many people you affect. You'd be surprised how many people are affected by you, positively or not. And that's the power we all have. So maybe all of us can say that today I take charge of me first. Firstly, let me start with me. And let me begin this journey or continue this journey of finding peace, awareness, relaxation as I pursue my dreams and goals. And then as I continue to evolve, I am a source of support and healing and love to people around. I think if we have enough collective who do that, then that has a profound ripple effect in society to counteract the forces of negativity, cynicism, despair that can happen in a world like ours. But we have the power to transform it. And it begins with your relationship with yourself and giving yourself, firstly, as I said earlier, the permission to detach your sense of okayness from all the outcomes and say, and that's what we're going to do now, this meditation where we connect with just the sense of okay as we. So, sure, sure.
I come from a religious tradition which is based on the understanding that true peace, joy, and purpose can be had only through a deep personal relationship with the Creator. So, how would you respond to that?
No, I think the creator is in every one of us. The creator and the creation is in every one of us. In that sense, I think we already have a deep personal relationship. with the Creator if we allow ourselves to see that we are the beauty of that creation. That is what, that we don't, nobody, and someone asked me a question about how can I stop judging. We have to learn how to use our judgmental mind, because we are all who we are, and there's nothing wrong at all with who we are. And we're all created, as you said, as an expression of the Creator, as express, just as the bird, as the tree, as the everything. We came from this world as an expression of nature. But then we entered into the human world where we're trying to fit in constructs in a way that is so difficult. And I agree with you, because your relationship with your Creator is a reminder that you are loved, that you are accepted just the way you are. You're beautiful just the way you are. There's nothing wrong with me just the way I am, because I have a relationship with my Creator. I'm immune to the negativity from the world. Absolutely right. It's very powerful. But that's why we have so many ways of getting. For someone, it may be an actual process of praying. For someone else, it may be an internal thing. So someone, it may be helping their child. It could be anything. But Creator and creation is everywhere, undeniably. And that way, we are presented with multiple opportunities to interact with other creations. How are we with other people? So I want us to think today, how are we with me? How are you with you first? Because I think, one of the things that is so powerful about prayer and about the belief in God and religion is, it's not debatable that many people, that it gives people great power, because we are craving the feeling of being embraced, of being held and told you are okay, just let it go, come to me. Maybe we had it briefly when we were little kids and our parents were present, but otherwise, most of us don't get it, and we want it, and we want it in different areas where we are disappointed when we don't get it. And it's a huge unlock then to have a perennial source of that. Imagine that's what it is, which actually tells us that love comes from us. When a person loves somebody, sure, the other person brought out the love, but the love comes from the human. I mean, I cannot feel the love if I didn't have it in me. And so I think what we are trying to do is feel that same love and being loved in this journey in a way that is not dependent on things that are outside our control. And I think I've seen the same love that people can find in their work. I've seen it when someone is in nature, someone is mountaineering, someone is on camping, someone is, we've all probably experienced this bliss, this beauty, right? This wonder of being. And I also see, by the way, when we are suffering, we have questions, When we are suffering, we have a lot of existential questions. Why am I here? Why am I born? What's the point of it all? What's the meaning? What's the purpose? When the suffering is gone and life is good, there are no questions. And I wrote a speculative piece, which I wrote for psychiatrists back in the US, which I am reminded of now, which is called The Death of a Buddha, where I speculated that Buddha came to a psychiatrist. He said, I'm sad. I said, why are you sad? He said, I'm sad because what's the point of living? We're all going to die. I want to leave my wife and my kid and go to the forest. I was like, oh, admit this guy. And we treated Buddha in this story. And so Buddha got well. But he never came up with Buddha. I've often reflected on the nature of suffering and its spiritual implications. And it's important in our practice to know that it's both. That without suffering, we don't evolve. And yet, as a doctor, my job is to ease suffering. So, it's an interesting issue about human suffering, that we also have to ask ourselves if our expectation is a life without discomfort. And if you ask me what is the generational shift, I'm digressing a little bit, but just the generational shift, if you say, why are more people experiencing, are they different? Well, there is a cultural shift in that the expectation of comfort versus discomfort has changed. Would you agree that previous generations' expectation was not that many of them didn't expect to feel comfortable. Yeah, I mean, gratification is not even a thing. Like, I mean, I've asked my grandparents long ago when I was interested in this, are you happy? And they would look at me with such a weird expression. What are you talking about? Did they have a concept of happiness? Did they pursue happiness? Did they pursue their higher self? Did they learn from, podcasters or people like me? No. Their expectations were very, very different. Their fundamental expectations were so different that when they went through difficulty, the receptor system, the brain itself is different. And you can't blame anyone for expecting what we expect today because the world has changed and technology only makes it harder, by the way. Technology, AI makes it harder and harder. And so, anyway, I'm going to get in. That's the subject of next. It should have been today also, but that's the whole subject about. And I'll just say, technology, because it's predictable, because it's designed to serve your emotional needs, creates. If we go on interacting with technology, this expectation that all of life will be like that. If I press a button, I get what I want. And so we start wanting things to be our way. We want people to be our way, which is what dating apps reduce people to, which is a list of attributes that I want. This objectification has occurred in every which way. And that's why it's difficult for the younger generation. Those who are older say, the young people are just, they're not strong enough or they're entitled and all of that. Well, they've been shaped massively by technology, massively by choices. And that is why the liberation of having all the freedom to choose creates this existential anxiety that the young generation have to face. And that is why you're going to see, parallel with this freedom and individuality, people also wanting to be told what to do. It's no accident that we're in times of great liberation, but also around the world, perhaps authoritarianism and so on. People want to be told what to do because we live in times of great uncertainty and chaos. So coming to our own center of clarity becomes really, really important in this world where your attention is being grabbed and they're trying to change how we relate to each other and to ourselves.